I've always been a very positive person, filled with energy, and up for just about anything.
As a psychologist, Dr. Paula Levine has treated thousands of patients with depression, but she'd never experienced it firsthand until last year.
It started with anxiety, major fatigue, some weight loss. I was losing motivation, I was not interested in seeing friends, and I thought, this is just not me.
Months of psychotherapy and high doses of medications failed to help, so Paula's family convinced her to consult her longtime family physician.
She knows me very, very well, which is why my daughters insisted on my seeing her, and she didn't recognize me the first time I walked into her office. I was like a shell of a person, or a shell of the person that she knew.
I immediately said, listen, let's continue your treatment with the psychologists and the psychiatrists, but let's look for something else, because this is so unlike you, and I just couldn't believe that it was all just a primary depression. So we started doing blood tests, we ordered chest x-rays, we got pelvic ultrasounds, I did CAT scans.
And nothing was wrong with my belly, but she didn't like what she saw on my left ovary.
Paula's gynecologist scheduled her for a complete hysterectomy. She woke up after surgery to a shocking diagnosis: Stage 1 ovarian cancer.
I went to visit her at the hospital that night. It was around 8 or 9 o'clock, and she had just come out of the anesthesia.
She said the most amazing thing. She said, no wonder you've been so depressed. This cancer has been sucking the life out of your body.
As Paula began chemotherapy treatments, Dr. Mitch referred her to psychiatrist Dr. Beatrice Currier of Miami Cancer Institute, an expert in the link between depression and cancer.
So cancer patients are 3 times more likely to develop depression within 5 years of their cancer diagnosis when compared to the general population. And there's now compelling evidence that the link is systemic inflammation. And in Paula's case, the ovarian cancer had gone undiagnosed for months. There is a release of inflammatory signaling molecules that are called cytokines, can pass into the brain and produce neurochemical changes in the brain to mimic symptoms of depression.
Had it not been for the depression, I don't think we would have discovered the cancer.
Listen to this story. Just listen to this story and realize, it's really, really important to have somebody who knows you, who understands you, and not only you, but your family history.
Paula has completed her cancer treatment and returned to her normal life.
The joys in my life are the joys that I've always had. I have 2 amazing daughters and 5 amazing grandchildren, and I love theater of all kinds. I love having my body in motion, so I do yoga and Pilates, and I swim. Emotionally, I am myself. I am totally back to my former pre-depression, pre-cancer self. And I'm cancer-free. I can't ask for more than that.